Good afternoon and welcome to the COVID-19 update on Channels Television. We begin with the total number of confirmed coronavirus cases in the country, which now stands at 30,249 after the announcement of 460 new infections by the Nigeria Center for Disease Control, NCDC, last night. Of this total, the center says 12,373 patients have been discharged, while 684 people have died from the disease. The latest cases were recorded in 20 states and the Federal Capital Territory, with Lagos having 153 infections, followed by River State, 49 cases. Oyo State has 43, Delta 38, the FCT 26, Anambra and Kano 20 each, Plateau 18, Edo 14, 13 each in Bayelsa and Enugu, Osun 12, Kwara 10, Borno 8, Ogun 7, Kaduna 6, Imo 4, 3 each in Bauchi and Gombe states, while Niger recorded 2 cases and Adamawa 1. According to the World Health Organization, there has been a 30% increase in the number of confirmed cases of COVID-19 in the African region in the past week. The WHO, in its COVID-19 African External Situation Report, says the coronavirus disease outbreak continues to grow in the African region since it was first detected in Algeria on the 25th of February 2020. It said that 4 countries account for 75% of all reported COVID-19 deaths in the region, which include South Africa, Algeria, Nigeria, and Cameroon. From its last external situation report it issued on the 1st of July, it reported a total of 91,038 new confirmed cases, a 30% increase. The majority were recorded in South Africa, which remains the epicenter of the virus in the region. South Africa is now among the top 15 most affected countries globally, with its cumulative number of cases exceeding that for Turkey, Germany, and France, which previously reported the highest numbers. The WHO Africa region says that South Africa recorded their highest daily case count of 13,474 and 10,853 respectively. Similarly, it registered the highest daily death toll of 225 and 192 respectively on the 7th of July. Now, the current figures in the region represent 3.4% of confirmed COVID-19 cases and 1.4% of deaths reported. Health workers have also been significantly affected by COVID-19 in the region, 8,036, 20% being infected in 40 countries. Since the beginning of the outbreak, overall, South Africa has been the most affected, 45%, so that's 3,583 health workers have been infected, followed by Nigeria, figure put at 987, in Cameroon, 593, Ghana 421, Guinea-Bissau 239, Niger 184, Cote d'Ivoire 179, Malawi 160, and the list goes on. It says that the highest country-specific proportion of health workers is 184 to 1,094, and that is in Guinea-Bissau. Now, following the rise in community spread of the coronavirus in the country, the Nigeria Governors Forum is advocating the ramping up of testing in affected areas. According to the forum, increased testing will help curb the spread of the virus, especially amongst those with pre-existing conditions and the elderly. This was part of resolutions at the forum at the end of its 12th COVID-19 teleconference, which held yesterday in Abuja, where it deliberated on various issues of national importance. Other resolutions of the meeting include consolidating measures to gradually open the formal and informal sectors of the economy, facilitating states' representation in the implementation committee of the Nigeria Economic Sustainability Plan through engagement with the Vice President, the need to revitalize the nation's mortgage bank to support the government's housing program and collaborate with the Ministry of Petroleum Resources, FIRMA, on implementation of 5% user charge on the pump price of petrol and the International Vehicle Transit Charge to better fund road projects in the country. Ekiti State Government says decisions on easing lockdown or reopening of some institutions are not cast in stone, as it is keenly studying developments across the border states and the country at large to guide its decisions. The coordinator of the state's COVID-19 task force, Professor Bolaji Aluko, says that the present time calls for caution and vigilance. He confirms that community testing is in progress across local governments in the state, noting that discoveries are not alarming yet. Meanwhile, fumigation of public schools in the state, we hear, will be starting soon ahead of the final conclusions to be reached on reopening of schools. Now, yesterday, the federal government reversed its earlier announcement on school resumption, saying that no school under the Ministry of Education will participate in the West African Senior School Certificate examinations earlier scheduled for August 5th and September 5th as well. The Minister of State for Education, Chukwuemeka Nwajuba, had announced that the examinations will take place between August and September. Now, the Minister of Education, Mr. Adamu, at the end of the Federal Executive Council meeting, said that Nigerian schools will not reopen anytime soon until it is safe to do so because of the COVID-19 pandemic. We have Mr. Yomi Fawemi, a human resources management development professional. He joins us for more on this via Skype. We'd like to thank you for joining us at this time.
Thank you. Thank you for inviting me.
All right, let's begin. The decision by the federal government, as a development professional, what does this mean for us, for the students, for the country?
I think it's a wise decision in the light of our current realities, with respect to what we have done and what we haven't done in terms of preparing our schools for emergencies. One of the realities of a time like this is that the Nigerian educational system, particularly our school system, has not been very effective in having a program to prepare schools for emergency. And as you have seen, when we have emergencies like floods, like natural disasters, we typically struggle as a country to know how to deal with that. So this is what has shown with what has happened. I align with the decision of the federal government to say that schools should not open because the schools are not ready to receive students yet. And our schools should be safe zones for students to learn. As of today, there aren't, and there's no plan in place to make them safe for students to learn.
So, but in terms of perhaps what decision WAEC should take, the Minister of Education also said that the examination council cannot determine the resumption date of schools for Nigeria. And so, you know, between an emergency situation and then looking on the students' part that they might have to lose an academic year rather than expose them to COVID-19, how does this impact the students and their development?
I mean, there are two, studies have shown all over the world that when schools are shut, there are two immediate impacts. One, students are not learning because they are not in school. Two, the second obvious immediate impact is that students forget what they have learned. There's already established in literature what is called the summer slide, that when children go on holidays for a long period of time, they forget what they have learned. Those are the two immediate academic implications of closing down of schools. But with the benefit of technology, with the benefit of creativity and innovation, society is learning to respond to reduce those negative effects. So whether it's from the point of view of using alternative ways of learning for students while they're at home, or whether it's looking for ways to be able to provide support to parents and caregivers to be more effective in helping the children while they're at home. It's something that we need to do. But the question we need to ask ourselves is, what's the hurry around writing WAEC? I mean, are students resuming in school so that they can learn, or they are resuming in school so they can write exams? The big question we need to ask ourselves is that the risk is that our students are not learning. The risk is not that they are not writing exams. So if the goal was to get our students back to school so that they can learn, it's totally different from taking your children back to school to go and write exams. And who said, and I've argued this on many forums, Nigeria is the biggest contributor to WAEC in terms of number of students. Who said that WAEC cannot start to think about having the exams done offline or online or doing an exam in such a way that students can write it from the comfort of their home. Who said that WAEC cannot recreate the way he writes his exam to make it safe for students? Because what has happened is that while everybody has decided to be innovative and respond to the issues around the COVID-19 pandemic, airlines have changed the way they do things. Media stations, even your stations have changed some of the ways to do things. WAEC still wants to write exams the way it has always written exams. Why has the Nigerian government and all the other governments in the West Africa sub-region not put pressure on WAEC to also respond to the COVID-19 and design an exam that is safe and people can write perhaps from the comfort of their home or in such a way that is designed to not expose children unnecessarily? I do not think that we should expose our children, our precious little ones, to the COVID environment just because they want to pass an exam. The more ridiculous part of it is that if a child passes this WAEC, the universities are shut. So the question is that if the goal is that take them back to school to write WAEC, and then what is the end point? WAEC is not the end. WAEC is the means. The end point is that those children should go to our institutions, but they are shut. So what's the point rushing people to a corridor called WAEC, and then the end of the road, there's no door taking them anywhere? So I think it's just good for us. Our focus should be our children should be learning. Our focus should not be our children should write exam. And we can create systems, use technology, use innovation to make them learn as much as possible, even though they're at home.
We appreciate your time, Mr. Yomi Fawemi, Human Resources Management Development Professional. Thank you for your thoughts on this issue.
Thank you for inviting me.
Now, over in Borno State, the government is working on addressing the shortfall of health personnel in the state by hiring more nurses and doctors. The decision is hinged upon recommendations presented by the state chapter of the Nigerian Medical Association calling for an urgent rejuvenation of the health sector. Is our correspondent Blessing Tuna Asol with more updates.
In Borno State, 563 persons have so far tested positive to the coronavirus since the index case was recorded in April. Now, 33 persons have died and 470 people out of that number have recovered from the disease. Now, you could also see that in recent times, the number of new cases have been relatively low compared to what we have experienced in the last few weeks, where new cases were recorded in 2 digits. Now, while this is good news on one hand, on the other hand, it is not exactly good news because when you recall what the COVID-19 response team said when the ban on interstate travel was still in effect, incoming travelers were intercepted at the city gates, their samples taken and tested, and we were meant to understand that most of those figures that we see in 2 digits at that time are that of incoming travelers who were tested, from the entrance of the city. But now with the lifting of the ban on interstate travel, people can freely move in and out of the city without having their samples taken or tested. Now, this is why stakeholders in the education sector are faulting the federal government's reversal of its decision to allow graduating students back to school when all other sectors are fully functional.
Looking at things here in Borno State, I think life has gone on. Markets are open, worship centers are open, businesses are flourishing, but schools should stay at home. Why only schools? I think the government should look into this because if you go out now, you will see how everybody is doing their things properly. And why should school that we have all the facilities that we can be able to do the proper distancing, proper all the protocols that have been put in place for this COVID-19 are already in place, and the government should not allow the schools to run. If you go to the market, come and see how people are moving around, not even using the face masks, nothing, yet they are moving out. So why should school be the only place to be closed? I feel the government should look into this and allow schools to run, because the school, by closing school, we are not doing any good to ourselves.
From Maiduguri, I am Blessing Tunu Aso for COVID-19 updates.
We have more on the COVID-19 updates when we return. Stay with us. Welcome back. Many have been curious as to whether herd immunity against the coronavirus disease might slow the spread of COVID-19. Let's understand how herd immunity works and what experts are saying about its potential impact on the pandemic. We have Dr. Shalamoni, a public health practitioner here in Lagos, and he joins us on the program. Glad to have you.
Thank you, Millicent.
First, let's start with what some people are saying, those that have recovered from COVID-19. They're saying that they're discovering new areas of damage to their system. For one person, it was fatigue, weakness, and then recurring cough.
Well, it's happening. In fact, I've seen individuals who were positive, treated, recovered, and they got infected again. So it's not a new complaint, really, but there are a lot of factors we need to look at. You know, when someone who has been declared negative is now still having symptoms. The first thing is this: was your test done earlier or later? What do I mean by that? If you do your testing shortly before the symptoms peaked or the viral load peaked in your body system, the tendency of having a low viral load or picking a negative result is high. Then if you do your testing at the tail end, when you have experienced all the symptoms and the viral load has, plateaued, it's possible to also get a negative result. So these are things we need to look at, if someone is saying he still has that. So there could be false negative, of the testing. Another thing is this: don't forget that anyone who has COVID has his immune system triggered. Either you had severe symptoms, moderate symptoms, or mild symptoms. Your immune system was triggered, cytokines, interleukins, several body chemicals were released into your body system, beginning from your nose to your throat, to the lungs, then to the blood vessels, to the organs. They actually worked. It has been reported that this could cause some blood clots. It has been reported that this could damage some organs in the body system. Affect the kidneys, affect the liver, and things like that. So even after you have recovered, the immune system that have been put on overdrive during your infection still leaves you with the traces of the symptoms. So it could take like 2 months, 3 months, 4 months before you recover. In fact, there was a study that showed that individuals who have had COVID and have recovered COVID may likely have stroke in later months due to the accumulation of blood clots in the body system. So it's possible. These are things you need to look into.
So the first thing is not to get it at all. Some people have described it as a tornado, attacking the body system.
Yes.
A bit of what you've also described. But when you talked about the viral load and the point where you take your tests, between 2 to 14 days or 2 to 10 days now, because we're also seeing a number of people spend more than 14 days in treatment or isolation centers.
Yes, it has been different strokes for different people because I've seen individuals who recovered 10 days, 14 days, 21 days. I've seen individuals who were there 28 days. In fact, there is a lady who I monitored closely, was still positive, for 2 months. So you want to look at this and say, well, different strokes for different people, depending on your immune system, how strong your immune system is. So these are the things you want to consider and say, well, it's not yet clear yet. It could be shorter, it could be longer.
Tell us about herd immunity and how it can be achieved.
Well, herd immunity is the resistance to infection by a group of population, a group of people. And before you can say a group of people have a collective strong resistance to a particular infection like COVID in this case, there must have been 70 to 90% of that population, offering that resistance to that infection. So if you are talking about herd immunity as far as COVID is concerned, you are looking at about 70 to 90% of the population being immune to COVID-19. It could be achieved in 2 ways, either through everyone getting COVID and developing antibodies towards the COVID virus, or the vaccination that confers immunity. Initially, when the outbreak started, a lot of countries, epidemiologists were saying that, well, we should just wait for herd immunity. In fact, UK said it, that they are going to go the herd immunity way. But the herd immunity way, due to exposure of the virus, is dangerous because there's a mortality involved here. So you can't really say you want to build herd immunity with exposure to the virus. So we have to slow down the spread while we wait for the vaccine to be available so that we can confer herd immunity on the population. For example, back to Nigeria now, if we use 70% of Nigerians before we can have herd immunity. We are talking about 140 million Nigerians. Now, if you look at the mortality of Lagos State, which is about 1%, so that means about 1.4 million people we have to die for Lagosians, for Lagos to have herd immunity. If you're looking at Nigeria, that was talking about 40 million. That's sorry, 2.3 million. That's massive. So we can't go in that route. We have to wait for the vaccine. But while we are waiting for the vaccine to get the herd immunity, to get 70 to 90% of the population being immune, then we have to slow the spread.
All right, and essentially the preventive measures, the safety measures.
You must continue
are most
social
important.
physical distancing, then wearing the face mask, avoiding large crowd gatherings. All those ones must continue. That's it, because there's a mortality involved there.
We appreciate your time. Thank you so much, Dr. Shalom Moni, public health practitioner. Thank you for joining us on the program.
Thank you very much.
Now, global coronavirus cases have surpassed 12 million, with over 6.6 million recoveries, but sadly, more than 549,000 people have died. For the first time in 100 years, the border between New South Wales and Victoria in Australia has been closed after a spike in cases in the city of Melbourne, and is back to lockdown as well. Here's more on our global update.
5 million Australians in the country's second largest city, Melbourne, woke up under strict stay-at-home rules on Thursday as the authorities struggled to contain a coronavirus outbreak in the city. The police could be seen stopping vehicles at checkpoints around the city. Residents in Melbourne, which went back into lockdown at midnight on Wednesday, have to remain home for all but essential business for the next 6 weeks. New Jersey's Governor Phil Murphy says he would sign an executive order requiring people to wear face coverings outdoors to prevent a resurgence of the COVID-19. More than 15,000 people have died in the state, ranking it second after neighboring New York State in the total number of deaths. Meanwhile, New York City Mayor Bill de Blasio has unveiled a plan for reopening the country's largest school system in September that would have students alternating between classrooms and their homes.
For the vast majority of kids, a typical week, 2 or 3 days in the classroom, in the school, the other days remote learning.
Brazilian President Jair Bolsonaro says he's doing very well after contracting the coronavirus and credited an unproven drug for his mild symptoms. Bolsonaro was seen in the grounds of the presidential Alvorada Palace in Brasilia after testing positive for COVID-19 on Tuesday, joining a small list of world leaders who have caught the disease.
COVID-19 Nigeria data shows that infected people over 64 years are 23 times more likely to die from the virus than younger people. From the NCDC, it says, take responsibility. You can visit their website. It has regular updates on the COVID-19 regulations and guidelines, information, statistics on cases across states. From the World Health Organization, your questions are answered on the Disease Situation Board. You can find the latest global numbers and from countries as well on a daily basis. It keeps updating the cases, the number of deaths, the recovery efforts across board. Our website, channelstv.com, has the latest news. All you need to do is log on. You can see that all states are in blue now with confirmed cases of COVID-19. There are other stories there from Africa and around the world. Channelstv.com at your fingertips. That's the program at this time. Thank you for watching. I'm Millicent Walker. Bye for now.